restricting. I also just would like to say parenthetically that when our children are little, it is a tendency to say, if you don't eat well, they're going to put that tube in your stomach and that's going to be a punishment. But it's not. It should be from the get-go something that when it's needed, it's really wonderful and it really helps a lot with a lot of the anxieties about eating. And we don't put G-tubes in until we need to, but never to consider it a failure on the part of the child or the family. Now, the common nutritional deficiencies that we find are iron, leading to anemia, zinc with poor wound healing, vitamin D for osteopenia, osteoporosis, and maybe selenium and carnitine, which have been implicated. We don't know much about what causes this cardiomyopathy, but we do know in other children without EB, low zinc, selenium and carnitine have been implicated, and we do find low selenium and carnitine in some of our patients. So we usually replace it if we find that it's low, but that's a little bit. There have been other studies looking at other vitamins, vitamin C, vitamin A, vitamin B6, and folate, but we don't really know how many patients are deficient. We do know that these vitamins are present in ordinary multivitamins, and so we often recommend taking a multivitamin, but it isn't clear whether we should be measuring these or replacing them. In terms of management, in yellow here, these are all topics that are going to be discussed elsewhere. But in order to facilitate intake, good dental care to keep the mouth as healthy as possible, esophageal dilatations to keep the esophagus open, G-tubes when needed, and prevention and treatment of constipation are really help us get things in, and then increase caloric intake. And this is really what Jen is going to talk to you about, how to get the right types of food with the highest possible caloric intake. Now, I mentioned this about the G-tubes, that families that fear the gastrostomy, they view it as a personal failure. They often can use it as a threat to their children to eat. But we really feel that once you have a G-tube, there's much less conflict between children and parents if eating has become an issue. And so we usually discuss this fairly early. In terms of constipation, you know, if you have severe constipation, you'd never feel hungry, and you just feel kind of generally miserable all the time. So we do very strongly recommend lots of lubrication and analgesics for anal fissures, high fluid intake for dehydration, and a very high fiber diet, and then stool softeners and laxative. We want things that are going to bring water into the stool. We don't want the kind of laxatives that just make the bowel move faster, because that often leads to cramping. Mineral oil will soften things up, but it can be aspirated, so we're a little bit wary, especially in the younger children, about giving mineral oil. And there are a lot of other formulations that you may have. We treat with vitamins and feel that we don't know exactly what everyone's deficient in, and that it's probably not a bad idea for all children to get a multivitamin on a daily basis and at least have their minimum requirements met. If zinc is measured to be low, we like to replace it, and we do have standards for approximately how much zinc should be given, you know, the zinc levels that should be appropriate for age and how much to give. And iron is necessary for adequate red cell production so you don't get anemia. We suspect that iron may not be totally well absorbed in recessive dystrophic EB. And so sometimes when we're just not getting anywhere with oral iron, we give iron infusions so we know that it gets there. And sometimes when anemia gets too bad, we actually have to go to transfusions, which also provide iron in the form of all the red cells that are being given. As I mentioned, we do give selenium and carnitine, although the replacement doses are not that well worked out. At our center, once or twice a year, we get a panel of blood tests, and these are the things that we measure. and we try to pick up any problems before they happen. So the blood count, the sedimentation rate, which indicates how much inflammation there is, and as it does the C-reactive protein, we look at the iron studies, zinc studies, and then check the major organs such as the liver and the kidney, the vitamin D and calcium for the bones, and selenium carnitine, and then the urine again to look at kidney function. We also, prophylactically, we get once a year an echocardiogram to make sure the heart is healthy, and we look at bone mineral density to make sure we would stay ahead of development of osteopenia and osteoporosis. So in summary, good nutrition is essential for good health and for normal growth. Careful observation of growth patterns can be very helpful in predicting when we need to move a little more aggressively and often use a G-tube for feeding. And routine surveillance for deficiencies and supplementation of vitamins and minerals is very important, not waiting till we get symptoms and problems. And finally, that both behavioral and psychological factors are very, very important to make sure that nutrition is not compromised by these problems with eating. So thank you, and I will turn this over to Jen, and then we're going to leave about 10 minutes for questions.
Get you out of here.
Just a little technical.
Okay, I'm going to move fairly quickly so we can get to some questions, but I'm going to kind of touch on the things Dr. Lucky did and kind of go through some supplements, high-calorie foods, high-protein foods, that kind of things. To start, just a general statement to say, I know nutrition is not always easy to get. We know this is a daily struggle, and I know it's very easy for us to tell you guys, give these supplements, do these foods, but we're not there every day with you, struggling to get these in with meal times in your busy schedule. So we do understand that. There are going to be days that are really great days, and those days you really need to focus on getting what you can in. We know there are days that are going to be not so good days where you're busy, maybe dressing changes go longer than normal. So again, we know it's not easy, but if we all work together, we can do the best that we can. We know meal times can be stressful often and very time consuming. A lot of these kids can take a half an hour, even longer to eat a meal. Try to limit distractions, try to sit at the table. A lot of times kids like to play and eat at the same time, so having them focus on eating. And children tend to eat better with their peers. A lot of times the parents will tell me they eat really well at school with their friends because their friends are eating. So try to, if that's your child, try to make that their big meal in the day. And just remember that every bite counts. So the most calories and protein you can in every bite they take. Calorie and protein